Hello everyone. Welcome to Grand Life Health Prostate Enlargement, also known as benign prostatic hyperplasia, BPH, is a prevalent issue among men, particularly those over the age of 50. This condition can lead to difficulties with urination, frequent urges to urinate, and discomfort or pain in the pelvic area, lower abdomen, and the region between the scrotum and anus. So, what exactly is happening in your body? As shown in this image, the prostate is a small gland located just beneath the bladder, which stores urine. Urine flows out of your body through a tube called the urethra. When the prostate becomes enlarged or swollen, it exerts pressure on the urethra, the tube that connects your bladder to the outside, leading to a range of issues. The swelling prevents urine from flowing freely, causing a backup and trapping liquid in your bladder. This can lead to poor bladder control, especially at night when you're trying to sleep. You may feel a sudden, urgent need to urinate, but only pass a small amount of urine. You might also notice that your urine stream is weaker than normal and could stop and start during urination. In some cases, you may have to strain or push to even begin urinating. Research shows that prostate enlargement can be triggered by hormone imbalances in the body, including elevated levels of hormones like estrogen, insulin, or DHT. Unfortunately, some foods are known to promote these hormones, further contributing to prostate swelling and heightening the risk of prostatitis, infections, and even prostate cancer. In today's video, we'll be sharing the top 6 foods you should avoid if you're dealing with prostate enlargement. We'll also provide a few simple lifestyle tips and remedies that can help reduce the size of your prostate and improve your urinary flow. Keep in mind that this video is intended for educational purposes only, so be sure to consult with your doctor if you have any health concerns. Let's dive in. 1. Alcohol. Alcohol consumption can significantly impact your body, particularly the liver and hormone levels. It acts as a solvent that damages hepatocytes, the liver cells responsible for metabolic processes. This damage can lead to hormonal changes such as elevated estrogen and insulin levels. High insulin levels can contribute to prostate enlargement, BPH, while increased estrogen exacerbates prostate issues. Additionally, excessive alcohol intake can raise blood pressure and weaken arteries and blood vessels, complicating the process of health. Beer, in particular, is known for its estrogenic effects, which can intensify hormonal imbalances. To support your prostate health, consider reducing or eliminating alcohol from your diet. Instead, try incorporating 1 to 2 cups of kombucha tea into your evening routine. This fermented tea provides a refreshing alternative and offers various health benefits. The probiotics in kombucha promote a healthy gut microbiome, aiding in detoxification and supporting liver function. 2. Processed meats. Processed meats include foods like salami, hot dogs, canned meats, pepperoni, and ham. Unfortunately, these are meats that have been processed and mixed with all kinds of chemical preservatives, nitrates, dextrin, sugar, soy proteins, and vegetable oils. Studies show that processed meats can increase the risk of cancer because of how they cause oxidative damage to the cells and form sticky proteins that clog up your arteries and cause blood clots. By damaging your liver, they also raise the risk of developing prostate cancer and make existing prostate problems worse. Cut out the processed and conventional meats and start eating higher quality meats from local farms. Ensure that your meat is grass-fed, grass-finished, and organic. This will ensure that no hormones or junk foods were fed to the livestock. Grass-fed meat is much higher in nutrients and will not contain the harmful chemicals added to processed meats. Grass-fed beef and organ meats like liver are packed full of zinc, heme iron, and proteins that support a healthy prostate gland and help to produce seminal fluid for reproduction. Please remember that everyone has a unique body and biochemistry, so it's important to trial and error removing foods from your diet and notice if your urinary or prostate problems improve. 3. Unfermented soy. Cheap, inexpensive soy proteins are being added to many foods. Soy protein isolates and soy powders are often added to diet shakes, ready meals, vegan meat patties, protein bars, baby formulas, and processed meats. Soy protein isolates cause a massive increase in insulin in the body, an anabolic hormone that can make BPH, prostate enlargement, and LUTs, urinary problems, worse. Soy powder also raises estrogen, another hormone that can cause prostate enlargement in high amounts. Soy is also GMO grown in the presence of chemical pesticides, herbicides, and insecticides, which are hormone disruptors. Finally, soy is rich in phytic acid, a chemical that can block your body's ability to absorb minerals like zinc, which are needed for normal prostate function. So, if you have any prostate issues at all, cut out all unfermented soy products. 100% organic fermented soy foods like miso, soy sauce, tempeh, and natto are fine. The microbes used in the fermentation process help to remove the harmful effects of soy, making it much healthier for the body. 4. Sugar. Whenever you consume refined sugar, flour, grains, or starch, your body initiates a rapid conversion of these carbohydrates into blood sugar, also known as glucose. This process occurs almost immediately, leading to a quick surge in blood sugar levels, particularly if you indulge in a large quantity of sugar in a single sitting. This sudden spike can be quite harmful to your cells, especially if it becomes a regular habit. To counteract this potential damage, your body responds by releasing insulin, a crucial hormone produced by the pancreas. Insulin plays a vital role in regulating blood sugar levels. It facilitates the transfer of glucose from the bloodstream into the cells, where it can be utilized as fuel and converted into energy. While this mechanism is essential for maintaining energy levels, problems arise when refined sugars and carbohydrate-laden foods become a staple in your diet. When you continuously consume these types of foods, your pancreas is forced to work overtime, pumping out increasing amounts of insulin to manage the persistent influx of glucose. This situation can lead to a state of hyperinsulinemia, characterized by abnormally high levels of insulin in the blood. Insulin is often referred to as a growth hormone because it promotes the storage of energy and encourages the growth of fat cells. As insulin levels remain elevated, your body may signal an increased need to urinate more frequently. This is particularly troublesome at night, disrupting sleep and leading to a cycle of poor rest and increased fatigue. To mitigate these issues and improve your overall health, it's essential to start reducing your intake of refined sugars and carbohydrates. Begin by paying attention to the sources of sugar in your diet. Common culprits include fruit juices, sugary sweets, biscuits, pastries, bread, sodas, cereals, and other flour-based foods. These items can significantly impact your blood sugar levels and contribute to insulin resistance over time, increasing the risk of chronic conditions like type 2 diabetes. A practical approach to enhancing your dietary habits involves setting boundaries around your eating schedule. For example, consider establishing a cutoff time for eating, such as stopping all food intake by 7 p.m. This practice allows your body ample time to digest and stabilize your blood sugar levels before you go to sleep. By allowing your body to enter a fasting state during the night, you may experience several benefits, including better sleep quality and a reduced frequency of nighttime urination. As you begin to make these dietary adjustments, you may soon notice a significant decrease in the urgency and frequency of urination, particularly at night. This can lead to a more restful sleep, allowing you to wake up feeling more refreshed and energized. Ultimately, reducing your intake of refined sugars and carbohydrates is not just about managing blood sugar levels. It's about fostering overall well-being and improving your quality of life. 5. Vegetable oils. Most of the common cooking oils are made from highly processed GMO grains like soy, corn, cottonseed, canola, grapeseed, and rice bran. Contrary to the name, these oils do not come from vegetables. Vegetable oils are used in fast foods, ready meals, deep-fried meats, store-bought salad dressings, margarine, and coffee creamers. These oils are rich in inflammatory omega-6 fatty acids, which can trigger massive amounts of inflammation in your prostate gland and especially in your liver. Your liver plays an important role in balancing out your hormones and filtering out excess hormones that you don't need. But when you weaken the liver by eating these refined oils, hormones like estrogen and insulin start to build up in the body and cause the prostate to grow, and the walls of your bladder lose their tone and become weaker. Start cutting these out of your diet and cook your own healthy meals at home using extra virgin olive oil, cold-pressed avocado oil, and organic raw coconut oil. We also suggest eating more omega-3 rich foods like oily fish, salmon, sardines, and pasture-raised eggs. These are anti-inflammatory and will counter any damage from eating too many vegetable oils rich in omega-6. 6. Dairy products. If you're experiencing issues with urination due to an enlarged prostate, it may be beneficial to reduce or eliminate dairy products from your diet, including butter, cheese, milk, yogurt, and cream. Dairy foods derived from cow or goat's milk contain natural growth hormones such as prolactin and insulin like growth factor 1, IGF-1. While these hormones are essential for the growth of infant animals, they can irritate an already enlarged prostate. This irritation may cause the gland to swell further, increasing pressure on the urethra, the tube that carries urine out of the body and bladder. For individuals without prostate issues, dairy can be a nutritious part of the diet, offering valuable nutrients like calcium and protein. However, if you're dealing with benign prostatic hyperplasia, BPH, it's worth experimenting with a dairy-free diet for 1 to 2 weeks. Pay attention to any changes in your symptoms during this period. You may find that cutting dairy helps alleviate discomfort and improves your urinary health. Making this dietary adjustment can be a simple yet effective step toward better prostate health. Later in the video, I'm going to share with you 6 lifestyle changes and remedies that you can use to help shrink your prostate back down to its normal size. But first, let's take a closer look at what causes prostate enlargement so you can really understand what's happening in the body and why these remedies are so important. One of the most common causes of an enlarged prostate is poor diet, specifically the consumption of too many refined foods. Foods high in sugar, processed grains, and refined flour can deplete the body's reserves of essential minerals such as zinc. Zinc plays a critical role in regulating hormones like testosterone and dihydrotestosterone, DHT. When zinc levels are low, the body may produce higher levels of DHT and other hormones like insulin and estrogen, all of which can contribute to the enlargement of the prostate gland. Additionally, being overweight is a significant risk factor for prostate enlargement. Excess body fat, particularly around the abdomen, leads to higher levels of estrogen and insulin, both of which are linked to the growth of the prostate. Studies have shown that men who are obese are more likely to experience BPH, as well as more severe symptoms. Another factor contributing to BPH is the body's decreasing ability to absorb essential nutrients as we age. As men get older, stomach acid production tends to decline. This reduction in stomach acid can impair the absorption of critical nutrients like zinc, magnesium, and vitamin D, which are essential for maintaining prostate health. Lastly, one of the most overlooked factors in prostate health is stress. Chronic stress can lead to hormonal imbalances, including elevated levels of cortisol. Excess cortisol can increase the levels of insulin in the body, further exacerbating prostate enlargement.